Hi everybody, Dr. Grover here today, and I am so excited that we're joined by one of my favorite patients actually, who I've gotten to know and who I consider a colleague as well now, Dr. Kristen Ghersi, who is a PhD psychologist and an amazing individual in terms of her being a champion for well-being, wellness, and mental health. So welcome, Dr. Ghersi, today.
Thank you so much. I'm so excited to be here.
Yeah. And so, walk us through how you got involved in being a mental health practitioner and a PhD psychologist,
Sure.
and what does that look like?
So, growing up, I was always very interested in people. I grew up, I was a twin, and so relationships, developing that was always very important for me. Then, when I went into my undergraduate degree at Michigan State, I originally went to as pre-med because I wanted to get into the medical field. But then in trying different psychology classes, I became really kind of fascinated with human behavior, the mind, different personality types, and then kind of made that shift and transition over to that. Especially with making a niche in terms of clinical psychology and wanting to open up my own private practice. It was really about kind of developing one-on-one relationships with people to kind of foster a sense of kind of like safety so that people can live, a better functioning life.
Yeah, I love how you use that word functioning.
Yeah.
And I think oftentimes mental health can become taboo, and we sometimes forget how crucial mental health is in the functional capacity. And if you look at even when I practice as a functional medicine practitioner, we're looking more at the biochemistry of the body. And I think now that we're seeing so much how there is an interplay between mental health and the biochemistry of the body, what have you noticed about that in terms of your patient's progression?
Well, luckily, I feel like, especially over the last decade, I feel like mental health and emotional wellness has become less of kind of, luckily a taboo subject. Whereas I feel like, a decade ago, it was almost like ensconced in like a sense of shame if someone were going to therapy, or you had to be in a sense of like an acute crisis. But now I feel like a lot more people are talking about it just as kind of important as going to, an MD or a DO, being able to touch base with a provider that's going to be able to listen to you and help you along some difficulties that you're having, emotionally speaking, and that is absolutely functional based as well, because when we're able to change our thoughts, our behaviors, and our actions, that has a lot of implication towards our physical health as well.
Absolutely. And I think that point that you mentioned in terms of like making it kind of similar to seeing your physician or primary care doctor, I think one of the things that we noticed as healthcare providers as a large in terms of the pandemic, in terms of being isolated and realizing that people do have anxiety, people do have loneliness, people do have potentially underlying depression going on that hasn't been addressed, or maybe they are. Just before we started, you were sharing with me about doing Dry January, and I think that's also interesting how we started to see those trends emerge after the pandemic because of potentially being dependent upon vices. So can you tell us a little bit about what you've seen in the last 5 years or so with kind of dealing with COVID, the pandemic, dependency on substance abuse, things like that?
Yeah, no, definitely. I think in the beginning of when we had kind of the shelter in place was maybe for the first time for some people of people really having to kind of sit with discomfort, sit with their feelings. We live, a very fast lifestyle, here in our country where we want things done, we want them fast, we have a lot of different distractions, we have a lot of different vices. When everything was kind of completely shut down, we were forced to really just kind of stay in our homes. And a lot of the anxiety, the depression that I think a lot of people were using like external coping strategies to kind of distract themselves with, they didn't have those. So we noticed a lot of that discomfort kind of rising to kind of the surface for people. Of course, a lot of people were kind of going again to those kind of quick fixes with food or alcohol or substances. But I think a lot of people were also noticing during that time that they did kind of develop a crutch with those substances. So then when things started opening back up again, they started noticing, like, why am I relying more heavily on these things? And to kind of broaden everybody's kind of awareness of there are more adaptive coping strategies that we can use to kind of mitigate some of that discomfort for ourselves.
Absolutely. And what are some things that you have, or some practices I should say, that you've discussed with your patients that you've seen that really help them on a day-to-day, which is something that they can kind of keep in their back pocket as a tool to get them through a day when they are sitting with that discomfort or sitting with their feelings that may not have been dealt with appropriately?
I think one is just the acceptance, and then being able to become curious about different, maybe uncomfortable feelings, rather than facing with kind of judgment. Instead of becoming, scared or fearful if something anxiety provoking kind of comes up, it's a good thing to kind of pause and reflect, like, what I'm feeling right now is anxiety. It's okay to feel anxious. It's usually, emotions are signals, and especially for something specifically like anxiety, is showing that something is important to us. So being able to look and view upon it in a very non-judgmental way is, I think, the first thing that I encourage people to do, is to look at it in a very self-assured, non-judgmental space, rather than kind of judging ourselves of, why am I feeling anxious today, or today's gonna be a horrible day because I have this feeling, whereas we can just kind of view it as, okay, I'm feeling anxious, and then accepting it. Whereas we can open up to more self-compassion of noticing, I'm feeling a little bit anxious today. What are some things that I can do in a compassionate way to help with this feeling throughout the day?
And I love how you say that, where it's actually reducing the intensity of that label of anxiety, where it's like the same thing to say, I feel a little bit groggy today, or I feel a little bit of like a headache, or I feel whatever that blank is that somebody may be feeling, happy, sad, excited. I think that the concept of being okay with putting in the word depressed or anxiety or anxious, nervous, uneasy, whichever adjective kind of comes to the person's mind, I've noticed by kind of taking away that weight that those words kind of sometimes hold, makes it a lot easier for patients to go through that process. Now it's almost like they're going through a familiar emotion or process that doesn't feel like such a weight on them overall.
I think sometimes when people grow up as well, is that we get told certain emotions are kind of unacceptable or unappealing to experience. A good example of this, I feel, is anger.
Yeah.
Or you should never be angry, and anger is kind of like dangerous or scary, or we need to. But anger is usually a sign that, like, our boundary has been, stepped over. So to be able to work with it instead of kind of against it, we're not able to like cut any sort of emotional experience from our life. I always joke with patients, it's like, you're not a robot, you're a human being. So if you want to be able to experience something like happiness and joy, we're also going to be able to have to experience kind of grief, sadness, and anger as well.
Yeah, absolutely. And I think it's interesting to see now how individuals are putting in place self-care and opportunities to invest in themselves in a way where they are optimizing themselves so that their boundaries may be expanded, where they're able to be more resilient, where they are able to handle more that life throws at them. And I think that, from the time I've known you, you are an amazing mom, you're an amazing wife, and all of the other hats you wear in your life. So can you kind of talk to us about your personal journeys, about how certain things you've done to invest in your physical, mental well-being, that has allowed you to do so many of those other things outside of your own personal life, like being a PhD, being an entrepreneur, being a mother, being a wife, and all of those other amazing experiences that you've been able to do?
Yeah, it's definitely been a learning curve kind of along my way and along my career. I would say that I always grew up with a very kind of healthy focused and health focused, fitness focused life. You know, my mom owned a gym growing up. She was a personal trainer. My dad was an entrepreneur. So I was able to kind of see that along the ways, but I never knew that that was going to be kind of the route for us. I was active when I was growing up through my teens, but when I really kind of leaned into fitness and self-care was actually after I became a mom to my daughter Vivian 9 years ago. I had a difficult postpartum adjustment, struggled with depression and anxiety, and I think in undergoing such a huge life role shift as in becoming a mother, I felt a little lost of myself, and I think fitness was something that I could kind of separate outside of being a mom, do something that was just totally for me, that was very grounding and mindful, something that was helpful for stress relief and kind of giving myself permission to take care of myself. And I think with that became a more in-depth looking at nutrition, making sure that I was eating nutrient-dense foods more often than not, taking a look at my hydration, making sure I was drinking enough water, which is a very simple strategy that I feel like a lot of people kind of continue to struggle with. And that has kind of carried over much into my postpartum experience with my second child. That was very different. In terms of working with individual patients, I also encourage mindful movement, nutrient-dense foods, hydration, sleep hygiene, sleep skills, also very important for myself and something also that I encourage with other people. And then also taking those little bits of time, no matter how short that we have, and being a busy working professional and mom, and being able to kind of ground myself in the present, because I feel like sometimes people get very caught up during the day and it can feel very chaotic. So being able to take those, mindful breaths, I think are very, very important and something that we should definitely give ourselves permission to do.
Absolutely. Mm-hmm. And it's interesting, we just posted about a few breath techniques.
I saw that.
And yeah, it's interesting that even my mom, she was telling me that somebody was telling her about a breath technique, or that she was telling somebody else about a breath technique, and then that person was like, oh, your son just posted about something, and she was like, because my mom's not on Instagram.
No.
So yeah, so it's kind of interesting when you mentioned the breath, and I just attended a conference where they did talk about how we just don't breathe correctly, and how it's some of the simple things that our ancestors used to do on a daily basis in terms of breathing correctly, chewing correctly, consuming nutrient-dense foods like you're saying, and even certain things like resistance training that I know you're very passionate about at 5 a.m. or whatever super early time that I know that you lift, that people that had to go to like the well to get the water, to pick up that water, you're doing a squat, you're picking up kind of like a heavy weight, you're doing those kind of deadlifting motions without necessarily doing them in the gym. So I think that it's a very interesting thing that we can kind of learn from our ancestors, certain things that you now kind of automatically do now in your lifestyle. And part of that lifestyle that I think is also that parlays very interestingly also is our outward appearance to ourselves. Mm-hmm. And so I know that's another topic that's very passionate, that you're passionate about. If you can kind of touch on that as well, that would be great.
In terms of like aesthetics.
Correct.
And how important that is to me. Oh, absolutely. So in kind of my journey alongside kind of feeling good about myself, I think it was also important when I started my business to be able to kind of feel like I'm confident and feel good about myself in terms of like outside aesthetics too, and that's when I met you, and being able to kind of give myself permission to invest in things like Botox and filler, and being able to kind of schedule that in for myself, to be able to feel just overall confident. I'm confident kind of internally as well, but I'm also client facing so much of the time. So I think that was also an important permission that I gave myself to be able to do as a busy working mom and give myself those breaks.
Absolutely. And I think that one of the other observations that I think you could probably agree upon is patients look to us as guides, not just of what to do, but how to do it in our example.
Sure.
So I think if patients see us investing in our physical, mental health, as well as their skin health, and taking care of ourselves, really, that gives them the confidence that, okay, Dr. Ghersi can do it. Dr. Grover's doing it as best as he can. That other individuals in our community are doing it, and so that means that we can also strive to do it as well. It's just a matter of creating that lifestyle that you were mentioning.
Yeah, and it's not an all or nothing, black or white concept as well. I think in the mothers that I work with, and I think I do draw a lot upon kind of like personal experience and being a working mom, having 3 kids, having my own business. Like, no day is typical. It's not every single day goes the exact same, but kind of imploring the adjustment that it takes in being a working parent is that every single day is going to look different. You have to be able to kind of shift and adapt, but to give yourself permission that if an hour workout in the beginning of the day just isn't in the cards, you can stretch, you can do breathing exercises, you can honor that your body needs rest one day or go for a walk. But I think it's also, like you said, being able to kind of frame for those people that we work with, of being able to show them that like it is possible, and to be able to show that it's important for us as well.
Yeah, absolutely. Yeah. And looking forward, I know today's kind of the last day of your dry January. What are some other wellness or well-being practices that you're looking forward to incorporate, perhaps for your patients, for yourself, in 2025?
In 2025, I mean, this whole experience with kind of dry January, that kind of came upon kind of a whim with my husband and I.
Yeah.
We were able to really notice a big change. I feel like in like stress tolerance with like our girls, our sleep kind of improved. So we were kind of joking that like, should we do it another month? Like maybe not, or maybe we like really modify the amount that we do drink. So that was very interesting, and something that I'll definitely kind of take on moving forward. I think I'll continue to prioritize movement, especially with regards to weightlifting, which is something I'd only recently been kind of partaking in. I was originally kind of very much into cardio. But I'll definitely continue on with weight training. Prioritization of protein, I think, was also very important, something that I just started kind of looking more into. Definitely looking towards working with nutrition and maybe exploring like supplements in different types of ways. I'm also very curious about, to be able to see. So that's definitely on my list for 2025.
Awesome.
Yeah.
Awesome. Well, this has been great, and I think my hope is that patients are inspired by your journey and are able to seek you out for mental health assistance and getting to their goals. What's the best way that patients can reach you?
Sure. People can find me online at Dr.Kristen Ghersi, PhD, or on my Instagram at Dr.Kristen Ghersi.
Beautiful. Well, thank you, and I look forward to doing this again.
Yes, absolutely.
Yeah.
Thank you.
Thanks.